Hello, everyone. This is Dr. Marra with Dr. Marra's Medical Minutes, and today we're going to talk about internal tremors and vibrations, the sensation that you are shaking on the inside. It's very, very common. It's common in mold illness, it's common in COVID, and it's common in MCAS. And what we think is going on is the internal tremors and vibrations that you feel are the result of a dysregulated autonomic nervous system. And as a result of the dysregulation, you have the sensation that you're shaking on the inside, and it is not pleasant. You almost feel like you're a percussion instrument on the inside. The way that you heal from dysregulated autonomia is to treat the infections, whether it's Lyme disease, Bartonella, COVID, or MCAS. MCAS really isn't a disease, it's basically histamine dysregulation. But histamine dysregulation leads to and can lead to autonomic nervous system dysregulation. Histamine is very, very inflammatory, and it's very toxic in chronic high levels to the nervous system. And not only to the nervous system, but to like tissues, for example. It very much degrades collagen, and it's just very inflammatory. It's toxic. I mean, obviously you need it as part of the allergic response, but in MCAS, you have a continuous release of histamine that causes a myriad of problems because it's so inflammatory. So, what we do to handle internal tremors and vibrations is we treat the underlying infections, whatever they may be. They could be tick-borne, they could be mold, they could be COVID, they could be MCAS, which usually the root of MCAS is either mold or some sort of infection, including COVID. If you treat the infections, then the drying up of the infection lowers the histamine, and by lowering the histamine, you get less sort of degradation of tissues and less pressure on the autonomic nervous system, and that allows the autonomic nervous system to heal. You can get rid of internal tremors and vibrations, but it takes quite a long time. It's a difficult symptom to treat, for sure. And I find it to be most difficult in patients who have mold illness. That's where I see it the most, in people who have autonomic nervous system dysregulation secondary to chronic mycotoxin exposure. Those people will frequently have internal tremors and vibrations. So you need to treat the mold. You need to get yourself out of the moldy environment immediately and begin to heal your tissues, and those internal vibrations will recede over time. But it takes a while. It's not going to happen in a month. It'll take, depending on how many mycotoxins you have and how long you've been exposed. But I would say it takes at least 1 to 2 years to get rid of the internal tremors and vibrations. So I hope this information has helped you, and I hope you have a wonderful day. Take care.